Welcome to Empowering Seniors, the web series. I'm Katherine Ambrose, and I'm joined today by some phenomenal professionals that I'm going to let introduce themselves. We're talking today about the silver linings for house calls and telehealth and in-home care as we all work to address the pandemic. Welcome, ladies. Kara Tipton, you were on one of our interviews just the other day. If you could introduce yourself, that would be awesome. And tell us one silver lining you can identify so far.
Absolutely. Well, I'm Kara Tipton. I'm the home care consultant for Home Instead Senior Care. So we provide supportive services for seniors in the home. And one of the biggest silver linings I have seen is actually having more family interaction. I know that sounds kind of crazy, but because I'm able to do consultations and get whole families together when talking about care for a loved one, I can get people from all over the country, sometimes all over the world, to come together to plan care for a family member. And I think that's a silver lining that we're just going to keep on doing. I can still go into someone's home, but yet get onto a Zoom video like this and have everybody involved so that everyone has a voice and everyone can really help rally and support that loved one who might be feeling really insecure about having someone come into the home. So I think the family interaction has definitely bumped up since all of this has happened.
I think that's phenomenal. We're caregivers for my in-laws that are 90 and 85. We're always juggling all kinds of things. We have a long distance sister, and I think for everyone to hear what's going on together, I can just see the benefit in that. Plus, sometimes it's hard for the patient to relay the information correctly, or they may not think of the questions to ask. And that's really terrific. So Kara, thank you. Emily.
Absolutely.
Yes, so my name's Emily Van Dever, and I'm part of the business development team with Mobile Medical. We provide basically in-home doctor's visits, like old-fashioned house calls. So we're able to come to you versus you having to get out and go see your doctor. Especially in a time like this, it helps. And I think one of the biggest silver linings so far coming out of this is that we're using the internet and technology the way we should have been, maybe for the first time. And it's just kind of like what Kara said, socialization and being able to talk and interact with those people is so, so important. So I think that that is a big thing for kind of everything that's going on.
Great point. Who would have thought it would take something like this to jog our minds into thinking about how we really can benefit from technology. And also, who would have thought we'd go back to having house calls? I mean, that's tremendous. So people don't have to go into the hospital or the doctor's office and risk being exposed to COVID-19 or something else. And plus, just a lot easier. Great. Okay, Amy.
Hi, I'm Amy Hardin. I am with Serenity Home Health and Hospice. We provide care to patients both in the homes as well as facilities. If they happen to be there, we can also be doing hospice and home health and facilities depending on the tier of care that is there. I'm the marketing liaison for them. I would say probably what I've noticed, both Kara and Emily have said it great, but it's almost an increase in communication. We're being more creative on how we're communicating. We're using FaceTime and texting and emails more across all of our teams. So whether it's with our nurses and our therapists or back at the office, or even with our patients and their families, it's just given us all more of this collaborative effort, and we're doing it more creatively than we ever have. Just a quick example, like if we have our hospice team and we're in a facility right now where families aren't able to go in because of the pandemic, our nurse will coordinate with the family, with our chaplain, and we'll get on FaceTime with the patient, with their family and our chaplain, and be able to communicate and share some really unique and awesome moments. So I think to what you all said, it's the same. It's creative, collaborative efforts, and everybody just coming together to care almost on a heightened level.
You know, Amy, I'm thinking that what you've described would make a perfect television episode for our local PBS too. just something tremendous that has come out of this. So thank you for sharing that, Amy. And Angie.
Hi, I'm Angie King. I'm the Director of Business Development for Mobile Medical. And just to expand what Emily had mentioned is we're able to use this crisis to come back to basics, to really turn our attention away from the day-to-day activities that took us away from what's really most important, which is our patient. We are seeing that it's bringing our patients and their family, even friends, together in a way that we never expected. We're able to offer them services in the home like we traditionally have, in the safety of their home with a nurse practitioner or a physician on site in their home, personal, or we can add that telehealth piece, which gives them an extra sense of security, but still have access to us.
That's awesome. So Angie, tell us what telehealth is, and then we'll have each of you add, because I know you all have some insight into that.
Okay, well, telehealth is very similar to what we're doing now, and there are different platforms that can be used. The platform we use is very easy to use for seniors, so it can be initiated either by them or by us. It's literally one link that's sent in a text message or an email, regardless of which way it's initiated, and they just tap that link, type their name in, and they're in our waiting room. And then the physician or nurse practitioner sees them in the waiting room, opens that up. They have to have camera and audio, very similar to what we're doing, and we're able to provide that care. We do modified assessments. We get creative in our assessments. It's helpful to have someone on site to maybe be our eyes and ears, listen to the heart sounds for us, take vital signs for us. But we're able to do a complete and thorough exam, surprisingly, using this technology.
That's awesome. Are you finding that many of your patients are able to access texting and email and have camera, and how is that going?
A surprisingly high number of our patients do have access to at least a phone or a tablet or a computer. We have a certain percentage of our patients that have deficits of some sort that don't allow them to do that, and we are working with other agencies such as Kara and Amy's agency to be that extra person to help us utilize that technology.
Okay, well, that's good to hear that other people can help them. And I bet it's exciting for some seniors that haven't used technology before to participate in it.
They're generally a little nervous, I'm not gonna lie. Emily and I work with them to talk them through that. Our entire sales team, our staff has been very thoroughly trained, so even our intake and schedulers know how to work with our patients to help them feel comfortable. And several of our patients have planned to have family members there, but they jumped on a little bit early, and they completely made it through that test run before their family arrived. So it's really very simple to use.
Very good.
Once they get the hang of it, they absolutely love it. Like, they're laughing and having fun. We have a lot of ladies tell us that they need to do their makeup before they get on their calls. So I think it's really exciting and, you know, a lot of fun for them to be able to interact with us still.
Very good.
Absolutely. I'd have to agree. I think, you know, for us doing supportive care services, that's, you know, what most people would think of as running errands and doing dishes, doing the laundry, things that you can't really do via telehealth, even though I'm sure we all wish that somebody could do that for us. But I think, you know, we have a client right now who we do a lot of exercises with. He has Parkinson's disease. And so we still have weekly meetings with him with his caregiver. His wife helps him, you know, along, but she walks him through all of his exercises that he likes to do on a, you know, daily, weekly basis. And so he's able to still get his exercise, still have that companionship piece, which I think is what most seniors are really loving, is that you can still talk to somebody, you can still see them and have a conversation. So it's still really fun, and we can have the music playing, and we can still do the exercises, and we can still chit chat or talk about what's going on in the news or comfort them and make them feel better. We're just doing it in a little bit different of a way, that's all.
That's got to add a lot of excitement to their life, especially with the stay-at-home orders, just being bored at home.
Absolutely. It's everything against what we normally preach. We always say, get out and do something. Let's, stay out in the community and have some fun. And now we're being told, don't do that. And so we're already thinking ahead as a company, how are we going to pull everybody back out? Because once these orders are lifted, we've started a new pattern of staying home again. And so we're going to have to really change that mindset. So we're already starting to think about how we're going to retrain and talk to our caregivers about, making sure that our clients feel comfortable going back outside, because it's necessary. Companionship is number one when it comes to health for anybody. And so we want to make sure we get them back out there as soon as possible.
I mentioned my in-laws that are 85 and 90, and then my mother is in Chicago, and all three of them, they're completely bored. And so it's really good that we're coming together as a society and coming up with creative ways to still be social and not be isolated. Amy, what have you experienced so far? Maybe a story you've heard about regarding telehealth.
Well, we're very involved in there's a piece of the telehealth that Serenity is involved in right now. We are currently allowing our clinicians with our partners, whether it's like a mobile medical company or a doctor's office, where on the home health side, we'll have a nurse out there already going out there for the home health visit. And she's able to actually do the visual call with the physician so the physician gets to see the patient. They've kept him out of the office. Obviously in this time, we're trying to keep people safe at home. And they're able to see their patient and have that interaction with our nurse there, so that our nurse can take the vitals and can provide some of that hands-on technique and test that they're needing. And they're doing that for the physician right there on a FaceTime or an iPad. So it's kind of an extension of this telehealth that Angie's talking about. And we're really seeing it work. And the physicians and the partners that we're working with are really, I'd say it's just a nice team effort, because the patient's first and we're taking care of them in a safe way.
I almost wonder if the doctors could see more patients that way. Having the nurse there is tremendous, because you have the nurse there, has a third party, and has a professional able to be part of that conversation too. That's so beneficial. And to be able to relay things to family or to go over the details later.
Absolutely. Yeah, it's working out really well. And like what Angie said, that's basically been, it's just been a nice added to be able to do for everybody right now. And it's working.
Very good.
And if they have a little problem with the technology, it is kind of nice to what we were just talking about, because the nurse, it's kind of neat because they'll actually show them, and then they'll know for another time, or like a normal telehealth call that they'll have with their physician later. So
that's so great.
Yeah.
Plus, it opens up a whole new world for them when they are comfortable with the technology, just to communicate with the grandchildren and great-grandchildren and their brothers and sisters. So I think that's really awesome. All right. Well, I have a few questions prepared. So we talked a little bit about how you're virtually working today. And also just like this, so many companies are having virtual meetings. And I really think it's going to impact business moving forward. And, sometimes people can't make it to a meeting, and kind you could have your technology going so that you have some people there live and some people are participating that way. So that's pretty cool. What kind of questions are your clients asking you right now?
In like regards to like the COVID-19 or just?
Let's say in regard to the COVID-19 and maybe with regard to avoiding the hospital and avoiding going to the doctor's office. What are some of the thoughts that people are having?
Well, I think, for me, I know the first thing they're asking for is the safety. What precautions are you taking? What are your caregivers doing on a daily, hourly basis to make sure that they're safe? So we walk them through everything that we're doing as a company. And I think all companies have standards right now that we're having to put in place. And that usually comforts them pretty quickly. I think what we're seeing is a lot of the clients that we're taking on right now have a really high acuity, so that, you know, they have a lot going on. They're really needing a lot of care, whether that's, you know, 16 to 24 hours a day. So, you know, the biggest question is, you know, who are these people coming in and how are they going to be able to help? And so just really comforting them and knowing, you know, our process is really the same. It's just heightened a little bit, and that we have more equipment and we have more ways to make sure that everyone stays safe and healthy. But really, it hasn't changed too much, and their worries pretty much go away after they understand what safety precautions that we're able to take.
Okay. How about you, Emily?
I kind of have been getting the same kind of questions as Kara. A lot of people, you know, want to know how to keep themselves the most safe. I think a lot of their questions just come from not knowing. So we do educate them on what we're doing, the extra steps we're taking as far as our caregivers, all the way down to, you know, how we sterilize our car every time that we see them. So I think just reassuring them on how cautious we're being helps them as well. And just kind of educating them on ways to be safe. Like, is it safe for me to eat in the dining room and things like that? Letting them know that it is, you know, best for social distancing, but we still want you to be able to interact and things like that. So just a lot of questions on how to stay healthy.
And so that question about the dining room, that would be for people that are living in a senior living community, and
Yes.
whether they should stay in their room or their apartment versus go down to the dining room.
Right. And I know that a lot of communities are, you know, of course, changing that now and taking meals to their room and things like that. But that is some things that we do get sometimes too. Or, you know, should I let my family come see me? Things like that.
And Angie, what are your thoughts? What are you hearing from people?
I agree with Emily. There's a lot of fear and anxiety, and a lot of it is not knowing. They want to know, number one, that if we are coming to see them, because we're there to take care of them in the safety of their home, so they want to know what we've done, what precautions we've taken. So we let them know that our staff is literally doing daily training in regards to safety in their care and staying continuously up to date on COVID. So that's probably what we hear the most is the fear and anxiety, and what are we seeing out there? They want to know what does the community look like? They're stuck inside and they see the news, and that in and of itself is scary, but they want to know what's really happening here in my town.
Exactly, because my family in Chicago, they're getting daily updates about what's going on. And in Wichita, I don't think we're hearing quite as much, or maybe it's just what I'm tuned into. But in Chicago, they're almost getting like an hourly report everywhere of how many people are sick and, you know, just all the statistics. And I don't know that we're hearing that much here. And what are you hearing about our community right now? We're supposedly about 2 weeks away from what they expect to be the peak. How is our community faring?
You know, I think the community is doing well. I hear a lot of issues around testing. So that's where I think most of us probably have our primary concern, is that testing either is taking 10 to 14 days to come back, or they're not able to access a test still if someone is sick. So they're just being placed on quarantine. Again, we have our caregivers who have to report any kind of illness that they're feeling whatsoever, and we make the decision whether they should see a client. But I've heard, not really from our caregivers, but maybe people that they know, that they're having trouble getting some of those tests. So I think that's what's concerning a lot of our clients as well too, is they just don't know who is sick because they don't know who's been tested or if they've been able to get a test. So that's still my biggest thing that I'm hearing from a lot of people and a lot of our clients too. That's the biggest thing that they call, and they're concerned that if they do get sick, is someone going to be able to take care of them, and will they know what they're sick with?
And has that been pretty easy to explain and bring some peace of mind?
Absolutely. So we just continuously go over the safety, washing your hands, making sure that you're, displaying social distancing, make sure you're staying home. So many of them are just begging our caregivers to take them out. They don't even care where. They just want to go out. And every once in a while, we're able to get them on a drive or something like that just to get out and get some fresh air. But we say, you know, you're the safest at home, and you're the safest when you just keep that social distancing and keep washing your hands. Some are trying to be overly cautious, you know, using the gloves and wanting a mask all the time. And I think while you're at home, that's definitely not necessary and could probably spread more and do more harm than good, especially with gloves. So just trying to ease their minds a little bit that everything is going to be okay. It is going to pass. But if you just do the right steps every day, you won't have to worry about getting sick.
And Katherine, I would add to that too, just from the home health and hospice side, we are going into these communities as well as the homes. And I think one of the things that has kind of come out of this that was really helpful in the beginning is we're a locally owned company, and our leadership is really, they've been very proactive, especially with this. They are normally anyways, but they've been really good with this. And they had some COVID-19 actually pamphlets where they took the CDC information right at the get-go and formed them into healthcare professional packets. And we were able to distribute that to the facilities and help them in educating their residents on COVID-19, because as you guys know, it just kind of started coming. I think the education, like Kara said, they're in the homes, they're talking about how they're safe and they're keeping them safe and their caregivers safe. Same with Serenity. On serenityhomehealth.com or serenitycares.com, we have a full list of what we're doing for our employees every single day to keep them safe so that when they go out to serve, they are safe and they're keeping our patients safe. But I think the education around that has been a very, they just really got really good feedback on that, because that's a big thing. And there's different levels of education out there. So when you're saying, what are the communities saying? What are the residents saying? I think it's just about getting together and doing that education as best you can, you know, which everybody's doing.
So how's your leadership plugging in to current events, and has different smart minds around the country are figuring things out, around the world figuring things out? How's your leadership tapping into that knowledge in maybe those increased standard of practices and spreading that information throughout your companies?
Well, that's a great question.
Oh, go ahead, Amy.
Is that okay if I go? Okay, then
Yeah,
I'll
you go.
quiet.
Yep.
Our local leadership, they actually have a lot of resources that they've been utilizing. The CDC, the KDHE, they have trusted advisors, obviously locally and nationally. And I think that was probably from the get-go how they were so able to be proactive in the beginning, is they already had those our resources internally in place to be getting that together. So they were able to move quickly and effectively to help our facilities, our communities, and our patients here, and our partners. So but I would say they're utilizing a lot of resources.
Very good. And Angie, did you have something to add to that?
Really the same thing that Amy has, is that we have a huge network of experts in the field, and we're experts medically, and people look at us as experts. So we need to be able to disseminate that information. So we've been able to pull from all the key sources and put together the information so that it's understandable to give to our patients and to our communities. You had mentioned earlier about access to devices. We do actually have devices that we can check out to our communities if they have a group of patients there that need our service. And as part of that, we have a packet, and in our packet, we provide educational material about COVID and how to get through this.
So in the media, a lot of things that people hear on the news, I'm guessing, might not be accurate. And of course, that can really put you in a downward spiral, just mindset wise, getting depressed, watching too much of the news. But specifically the news about COVID going through nursing homes. And so if you could explain what a nursing home is compared to some of the different types of communities that people might be living in that aren't necessarily nursing homes. And so if you could speak to that, and also to what the communities are doing to keep all of their residents safe.
Well, the communities have been amazing, and we initially noticed a wide variety of some communities shutting down completely, some communities not so much. But I'd have to say over the course of probably 2 weeks, all of the communities really had it together, and they've got excellent screening processes in place. They've protected their residents, and they've got a system to allow the caregivers to access their residents. The difference between the communities, I think there's a negative tone to the nursing facility piece to it. But the nursing facilities or nursing homes that we're hearing about are group living settings for seniors or people with disabilities of some sort, and there's a variety of them. There's long-term care settings, there's assisted livings, there's home plus settings, independent living communities that are still group settings that we're able to access to take care of patients. So if anybody else has anything to add to that, please do.
Yeah, I think when you think of a nursing home setting, it is more of like a group home type setting where there isn't a lot of separation between the different residents who are there. Sometimes a room is separated by a curtain and they're just sharing a room. So the spread definitely is harder to contain because that 6 feet distancing, or you're constantly around other people, it's just really hard to stop.
Yeah.
And so some of your other traditional communities that you might hear of, a lot of the times they're private rooms or even semi-private rooms where they really can isolate themselves. I think in a more nursing home setting, it's just really hard to be isolated. And unfortunately, because of that, it does cause, something like COVID-19 to spread pretty quickly.
And so that's exactly what I was thinking, is you keep hearing about nursing homes on TV. And I think that a lot of people might be imagining the active adult apartment community down the street or the independent living community around the corner and think, oh my gosh, and think that they're really going to be in trouble there. And that's not the same thing as a nursing home.
Right.
Yeah, absolutely.
Okay.
Absolutely.
So how has this been impacting your business? Let's say impacting it in a positive way. So we've talked about the changes that you've made, but I would imagine that maybe more people are utilizing your services.
Absolutely. I think for us right now, kind of to what Angie was saying, there's a lot of communities who unfortunately are not taking a move-in right now, which is smart on their part. They're keeping their doors closed to make sure the virus doesn't spread. But because of that, there are still people who are in need, especially if they were, ready to go into more of an assisted living or maybe a memory care type setting. And that's where we're able to come in and help. What I really appreciate about Home Instead is that we don't have to go in forever. We can go in until their spot opens up or until that community opens up, but we can at least make sure they're safe at home, give their family that peace of mind that there's somebody there every day checking in. And so we can still help them out, but it doesn't have to be forever. It can be until, those great communities open back up, and we're partnered with many communities in the Sedgwick County area. So we definitely want to help out in any way we can. So that's going to be great. Partners keep those people safe and out of the hospital so they can move in. That's exactly what we want to do to help.
Okay. What about you, Emily? How's it been impacting your day-to-day business?
I think it's been really great because in times like this, we're actually able to reach people that we may not have been able to reach before, where there was a barrier for whatever reason before. A lot of people are using us as a resource now to either come in and see them, because we are still doing, like Angie said, the face-to-face visits. A lot of people still are comfortable with that. But then we also have telehealth as well for those, that don't have the immune system or are just worried about being around others. That way we can still really care for them. And it's just been really big for us. It's been a great opportunity for us to be able to offer them another resource.
Very good. So moving forward from this, we've talked a little bit about some of the practices that you've implemented that you think will go on. what are some of the other ways that you're thinking this may have permanently impacted how you work?
I think we'll continue to do telehealth. We'll always offer face visits because that's who we are and that's what people appreciate, is having us come to their home. But with the ability to utilize technology as we have, we've been able to reach a group of people that have been unreachable. I don't think, at least for what we're all doing here today, that this will go away.
Well, we don't know how long this is going to last, and if, you know, there might be things in the future that previously to this we've been unprepared for, and so now we're better prepared as a society. And I think it's good we're figuring out some better ways to serve people. What should families that have their elders in senior living be concerned about, if anything?
I mean, the biggest thing is just, you know, for a family to feel comforted is almost the same way as us comforting the client or the resident themselves, is just education and making sure they know what that community is doing every single day to help protect their loved ones, and then kind of reiterating what we're already telling them about, you know, the social distancing and hand washing and things like that. So that's the biggest way that they can help, is just be that extra support. And I think through things like this, when we're having teleconferences with families just to update a care plan, it makes them feel better because they're hearing straight from us. We're all communicating with the communities as well too. I'm sure all of you guys, just like us, are very aware of all the rules, and different communities are doing different things at this point. So it's kind of hard to juggle, but we're figuring it all out. And just being that extra voice for the community and for the family to say, hey, this is what they're doing and this is how it's going to work. So just keep encouraging your loved one to do what they're asking, and it's going to pass. It's definitely going to pass.
So speaking of hand washing, wash your hands, wash your hands, wash your hands.
Yes.
So we're hearing that nonstop.
Yes.
I would guess that there are many people that are hearing that and they think, okay, wash my hands, I'm missing the alphabet. But they might not be totally understanding why and how. So share with us some of your best thoughts on washing hands.
Well, your hands are what you're using to touch everything. So whatever anybody else has touched or whatever anything else has, your hands are the ones that are on it. So just being extra cautious. Obviously, we wash our hands after we do any kind of personal care, cooking, cleaning, things like that. But just understand that, you know, it's good to have that bottle of sanitizer and use that every once in a while. Even if you're just watching TV, your own remote probably has germs on it. So, you know, making sure you're sanitizing and washing your hands as much as you possibly can. But also remembering to use lotion as well too. A lot of our clients, their skin is thin and it's breaking down a little bit. And I mean, I can probably say with these ladies too, I'm washing my hands so much, I feel like they're just dry as a bone. So also making sure you're taking care of yourself and your skin and moisturizing as well too. Also taking those daily showers as well too. We're encouraging our clients to shower probably more than they normally do, but that does help with the spread of germs.
Okay, because so my family, when we go shopping and we come back to the house, they're stripping down the clothes, they're going right into the laundry, they're washing hair, taking full shower, and that's just a protocol that we've established in our own adult household. And I think that's a good point, that these germs can attach to your clothes and your hair. And also washing your fingernails. I mean, really working to stay clean, because people that, let's say they've had a bone marrow transplant, I know that they're given instructions on how to keep themselves from getting sick because their immunity is so far down. And that's kind of how we all need to be acting, as like we've just had bone marrow transplant and we need to be that concerned about cleanliness.
One added piece to that, I think there is some thought that you're just washing the germs, the cooties down the drain, but in reality, the way this virus works, the soap and water actually degrades that virus, so it destroys it. So
it's like it destroys like the fatty layer on the outside and yes, kills it. Okay. Yeah. And I know that's not proper terminology, because I know it's not alive, but that's what I read, is that you're breaking that down with
Breaks it down.
Yeah, and you're actually getting rid of it. Amy, share with us what hospice is. It's always a big concern for me when we are educating seniors and family members that they understand what hospice is. It doesn't mean that your loved one or that you are going to die. It's more about comfort. Could you tell us a little bit more about that, please?
Sure. You hit a very good point. I think, again, we've been talking about education and how important it is when you're talking to family members and patients. I think the biggest thing with hospice is the education level out there. And what we really try to do is educate families and our friends on what the hospice benefit can bring to their loved one. There is a piece of hospice, which you could call an end of life stage. And I think that's where people go to right off the bat. They think, I'm going to put my loved one on hospice and they're going to die. And that is a phase of hospice where we can come in and provide a complete medical team with a registered nurse, a certified hospice aide, a chaplain, a social worker. That's all part of the hospice benefit that your loved one will receive with hospice. But I think the biggest message with hospice is not only is the benefit and the care going to be something that will be, whether it's in the home or in a community, is that it's a journey, and we really try to educate families on getting their loved one qualified for hospice early on. Because usually families come to us with hospice with a lot of questions and where their loved one is at in their process. Are they going to die tomorrow? Are they a week out, a month out? And we really don't know. I mean, there are medical ways to kind of be able to tell where they might be, but we really try to educate Katherine on comfort care and providing an extra level of medical comfort care to them in their home or their community for this journey. So whether it's going to be a month, 3 months, 4 months, we have some patients that actually they'll plateau on hospice and they can come off that benefit. So I think the biggest fear of hospice is people are giving up and they feel like it's throwing the towel in maybe. And once we can sit down with the families and really talk to them about the kind of care they're going to get and what that means to keep them comfortable in a quality of life, and that it can be a comfort care versus an end of life stage, they really come around and say, okay, I understand that better. Yeah. Does that make sense?
Absolutely. Because I think sometimes people are very dramatic. They're like, oh, well, mom called hospice and I guess she's given up on dad. And that's so sad because they are totally missing the benefits of hospice. And nothing is better probably than graduating off of hospice. Get on hospice, you start feeling better, get more comfortable, and you can graduate. And it can be something that you bring in and out of your life as it's needed while you are suffering through some kind of condition. And it can be a huge relief to, let's say, the spouse or the adult child, whoever is the family caregiver for someone. It's such a tremendous benefit for them as well. And so tell us a little bit more about that and what kind of financial relief there is too for hospice.
Again, those are great questions. Well, as far as being able to, we come to the patient and we basically put our arms around the families because, to your point, the caregivers, whether it's the caregivers in the community or the caregivers in the home, we are working with them to be an extension to that team. So we want to provide that extra support and that extra care that whole team is going to bring to that family. So whether it's the chaplain or the social worker or the certified hospice aide or the RN, they're all collaborating kind of their efforts with the family members, because depending on if it's one caregiver at home or it's the facility caregivers there, that's their team and that's their family that becomes an extension to them. So they offer resources that they didn't have before the hospice benefit. Some of the things as far as equipment, if the patient's in the home, the hospice benefit will cover what's called DME equipment. So whether they need a wheelchair or a walker or a bedside table or a bedside commode or oxygen, all of that is included in the hospice benefit. It's not an out-of-pocket expense for the patient or the family. That's a big blessing to them, actually, when they find out, especially in the homes, that they can have that kind of equipment and care together at no additional cost to them. Also, and Angie, I'm sure can come in this from the medical piece of this, but there's qualifications for the diagnosis of what they will bring the patient on for hospice. And whatever that primary diagnosis is, certain medications will be covered by Serenity under the hospice benefit. And it alleviates the cost of some of those medications that can be very expensive for families. So the families really, once they know what we can do and how we're going to be there for them, it really does make a big difference. We have a bereavement program 12 months out that we're in constant contact with these families after they've lost somebody. We have a memorial every year out at Derby at the little pavilion where all the families come, and we actually read all the names of the lost loved ones. And so it just becomes a community in and of itself.
One of the things I've found fascinating and extremely helpful for families that hospice provides is respite care.
Yeah.
It's basically relief for families when they just need a break, or maybe they need to go take care of something out of town or even in town for a few days. That's something that's been an amazing option for families.
So
And that's a great point. Excuse me, Katherine, just to add to that, she's right on. And again, when these families are in their homes, and this is where they're at with their loved one, the respite care is provided by the hospice benefit. So what like Serenity would do if they were on hospice with us, we'll partner with our communities and figure out where they can go for, it's 5 days is the coverage. And we can put them in a safe community and get great care. Our team still goes with them to that community, and the family gets the break and gets some rest. So that's a really good point, Angie.
good. So basically, for our viewers, just stay curious and stay resourceful, be resourceful, and stay out of judgment about what any of these services are, and just know to ask some questions. Just reach out to some of these professionals or any professionals in your community, and see if there might be something out there that can really benefit you and your loved ones. So let's put together our final thoughts, the last word from each person, and we'll wrap it up. Emily?
I just wanted to say thank you. It's very nice that we are able to educate people. And I think we covered some great topics as far as everything goes, like the difference between a nursing home and, an independent living, assisted living, things like that. So I'm really excited. I think telehealth is taking us to places that we've never been. And it's really been great to see how caring and creative we've been able to get throughout this whole thing.
Awesome. Very good, Emily. Kara?
I just appreciate that we all got to come together and answer some questions, and to please reach out if there are any other questions that we can help you with. But remembering that there are in-home options right now to keep everyone safe and comfortable, and that we're a resource. So if we're not the ones that can help, maybe we can get you to a place or get you to somebody who can help. We all work together in this community. So please just reach out and we'll do everything that we can. And don't forget to wash your hands.
Good. And Kara, a special thank you to you for organizing this conversation and the wonderful panelists. So we really appreciate it.
Absolutely, not a problem.
It's nice when companies work together. I've been in real estate my whole life prior to doing this with the television station and doing our Empowered Senior series. And it's really inspiring to me to see how heart-centered everyone is that works with seniors, and the cooperative spirit. It's just such a nice breath of fresh air. So you're wonderful people, very dedicated, and we thank you for your service. Amy?
Well, that was beautiful what they all just said. I love the heart-centered piece because I think judging from the panel and even Katherine, you hosting this, we are all in this together. And I think that is the biggest point. However, we can care for all of our local families. We're here in different aspects of care, but we're all working together to provide the best care and ask questions, call us, because if it isn't us, like Kara said, or we're not that person, we know really good quality professionals in the healthcare system that can help them. And I think that's really key.
Absolutely. And we can help you no matter where you are or where your loved one is. And there's people just like us in all the other communities out there. And we can certainly help you connect with some of the right people and help get you started, give you some clues on how to track them down. And we have relationships with people all over the country. So even if you're not local or your loved one isn't local, you can still reach out and help.
Absolutely.
Get some help.
Absolutely.
Angie, anything else?
I would like to just leave on the note that even in the midst of this crisis, it's been an opportunity for us to get back to what matters, which is that patient-centered care.
You guys are awesome. Thank you so much. We really appreciate you taking time out to help educate, equip, and empower seniors and their loved ones. And thank you so much. This has really been awesome. So thank you for watching Empowering Series, the web series, and Empowered Seniors, the web series, I meant to say. Thank you for watching, and please reach out if there's anything we can do to help.